just reached 100 participants, so we know that many more are coming, but we will go ahead because we have a very tight schedule with a lot of great speakers. So I want to welcome everyone to the second of our weekly Thursday webinars, Capitalism is Killing Us, and this edition, Strike, COVID-19 and Worker Resistance, hosted by Workers' World Party. We appreciate your attendance and participation in this political discussion. My name is Dianne Mathiowetz. I am a retired auto worker who worked for 30 years on General Motors assembly lines in Georgia and New York. I am a member of UAW Local 10. And currently I produce a weekly radio program every Monday in Atlanta on WRFG 89.3 FM, a progressive community radio station that covers all the issues important to working, poor, and oppressed peoples, from conditions on the job, to police violence and mass incarceration, to imperialist war. Before we begin, and I know we are eager to hear about the determined, bold, and creative actions by workers fighting back against the exploitative bosses whose system produces inequality, poverty, and war. But first, a message, a word of solidarity with all those experiencing pain, loss, anxiety, sorrow, and fear of the COVID-19 virus pandemic that has taken so many lives globally and plunged countless millions into unemployment and massive insecurity. This crisis affects us all. As activists, we have had to make changes, not just in our personal lives, but in our organizing lives. And this webinar, in fact, is one of those new ways that we are now reaching out to working and oppressed people. But what this crisis has done, it has not shaken our confidence that the organized and conscious working class is the foundation of a socialist society. Che famously said on many and multiple occasions that a true revolutionary is guided by great feelings of love. In that spirit, we offer our love and solidarity to all who are suffering and yet resisting this capitalist monster and determined to win. Forward to building a workers' world. And with that, I will make a brief announcement. We are now live on Facebook, and we encourage everyone who is here to go on to the Workers' World Party Facebook page and share the video with your friends and place it in your Facebook groups and pages. I'm really pleased and excited to introduce the co-host of this webinar tonight, Megan Smith. I need to put my glasses on, folks. Megan Smith, Whole Foods worker. She is a member of the organizing committee of the Whole Food Workers, and it's called Whole Worker. And she is also a member of Workers' World Party in Philadelphia. So Megan, thank you so much for being a co-MC with me. I know that you are much more adept at this form of communication. And so I'd like to ask you to start off with a report on your organizing work. So I heard that you helped organize a sick out this week of Whole Foods workers. And can you share with our listeners what it was like to organize this strike and fight back against Jeff Bezos, just the richest person in the world, as a frontline worker in this pandemic?
Thank you, Dianne. So I'll introduce myself again. My name is Megan. My pronouns are they, them, and theirs. I'm a front-end worker at Whole Foods Market and an organizer with Workers' World Party for about 3 years now, and I've been at Whole Foods for about 2. I'll give a brief report back on organizing in Whole Foods in light of the COVID-19 crisis. We have bunch of wonderful panelists coming up. So like I said, I'll try to keep it brief, but there's so much to be discussed. So as the world goes into lockdown, enterprises and the workers that keep them running have been classified as either essential or non-essential. Non-essential workers are either working from home, if they're lucky, or have been laid off. The section of our class that now finds itself without work consists largely of underpaid gig workers and service workers, baristas, and bartenders, to name a few. Workers who are, though deemed unessential during this state of emergency, are essential to running what we might consider our normal economy. Workers deemed essential during a pandemic, on the other hand, healthcare workers, sanitation workers, transit workers, grocery store workers, laundry workers, and more, all have to continue going to work while everybody else stays at home. And we go in precisely so that everybody's able to stay home. At Amazon-owned Whole Foods, our bosses are expecting us to come to work and quite literally put our lives on the line for $17 an hour. $17 an hour is our $15 an hour minimum wage, including the $2 an hour raise that Amazon implemented in late March in order to quiet the criticism it had already come under regarding poor safety and compensation during the COVID-19 outbreak in its warehouses and in its subsidiary company, Whole Foods. Whole Worker, a group of Whole Foods employees who came together when Amazon purchased Whole Foods in anticipation of the need to unionize under their leadership, put out the call for the March 31st stickout, along with a petition and a list of demands. And then at each store, it was sort of up to the team members there to organize so that people would actually call out. The demands of the stickout are as follows. There's 7 of them. Number 1, guaranteed paid leave for all workers who isolate or self-quarantine instead of coming to work. So PTO as preventative PTO rather than reactive PTO, which we have now only in the case that someone is either exposed or already tests positive. 2, reinstatement of health coverage for all part-time or seasonal workers. Amazon cut part-time workers' health care this past summer, and so that demand is to reinstate that. 3, increased FSA funds to cover coronavirus testing and treatment for all team members, including part-time and seasonal. 4, guaranteed hazard pay in the form of double pay during our scheduled hours. Like I said, right now we're making $17 an hour. The double pay would put us up to $30 an hour. 5, implementation of new policies that can facilitate social distancing between workers and customers. 6, commitment to ensuring that all locations have adequate sanitation equipment and procedures in place, including additional PPE. And 7, the immediate shutdown of any location where a worker tests positive for COVID-19. In such an event, all workers should continue to receive full pay until the store can safely reopen. And as we've seen in stores from Chicago to New York, that's not being done. At my store, a Wawa next door actually had an employee who tested positive, and they closed for several days. Meanwhile, Amazon warehouses and Whole Foods aren't closing at all when employees are testing positive for COVID-19, which not only puts other employees at risk, but also the public. While the full extent of the participation in the stickout is unclear so far, at least hundreds of Whole Foods workers across the US called out on Tuesday. A number of stores in large cities such as Chicago, Philadelphia, and New York reported that for some teams, a majority of people scheduled that day on Tuesday called out. Both Whole Foods and Amazon dismissed the action and have failed to meet the demands put forth. But the stickout is only the beginning, and our fight is certainly far from over. Whole Foods workers are taking action as workers across the U.S. are walking off the job with similar demands. Pressure is mounting against Amazon as workers walk out in increasing numbers, refusing to return to work until warehouses through which infected employees have passed are closed and thoroughly sanitized. We saw this over this week with a Staten Island warehouse. Chris Small is the employee of 5 years, I might add, of this warehouse was fired in a blatant labor violation for organizing the stickout. And this is after at least 6 employees at this warehouse tested positive for COVID-19. And there was not even so much as a closure of the warehouse for any sort of cleaning or sanitizing. So in addition to that, Instacart workers went on strike on Monday to demand additional PPE, hazard pay, extended sick pay, and a higher default tip setting on the app. So workers across different but converging sectors are coming out to demand that we're protected as essential workers. So to answer the question that Dianne put forth, things are really challenging right now. Going to work during this crisis is stressful, it's scary, it's emotionally and physically taxing. However, despite these challenges and despite having to put ourselves in an already very dangerous situation with barely any additional protection, we have all been sort of thrust into a position such that we can make history and that we have leverage in the decisions that quite literally have life or death consequences for us. We are officially designated as essential and now have everything to lose. We are really the thread holding the system together and are in a position now to let go. And that really is the ruling class's greatest fear. And as Lenin put it, and as I find myself repeating over and over during this crisis, there are decades where nothing happens and there are weeks where decades happen. And we right now are living through weeks where decades are happening. So while our struggle has intensified, my fellow essential workers and I are increasingly ready to put up the fight that this historical moment demands of us. And we're ready to fight, frankly, because we have to win. Winning is now more than ever truly a matter of life and death, not just for Whole Foods workers and not just for Amazon workers, but for our whole class. So let's check out, we have 148 attendees right now. So now we are going to transition to our panelist presentations. Thank you for everybody to coming out and watching us. Keep sharing the link and inviting more of your friends. Each of our 8 exciting panelists that we're about to introduce are going to spend about 3 to 5 minutes sharing their experiences in the struggle. We originally were going to have 2 members of the Boston School Bus Drivers Union speaking. However, we have one at this moment. We have Stephen Kirschbaum, Vice President of USW Local 8751, Boston School Bus Drivers Union, and Workers' World Party organizer. Steve, you lead a revolutionary militant union of drivers, most of whom are from Haiti and Cape Verde. You are in the middle of a major contract fight against Transdev, fighting to keep your hard-won rights. How has this pandemic impacted your coworkers and your community?
Thank you, Megan, and welcome to all. We are in challenging times, and times that require our unity and solidarity and fight back, because when we fight, we win. Local 8751 represents about 1,000 Boston school bus drivers. We founded the local in the early 1970s in the heat of the struggle against racism that was taking place when they desegregated Boston public schools. And the union has had 12 strikes in that period of time, has a known history throughout the city, one that had been added to by a struggle that we waged in 2013 when the corporation that runs school busing now, Veolia, under a name Transdev, a multinational monster that oppresses workers from Boston to Palestine, literally. And they fired the 4 of the top leaders, and after 25 months, the head of the corporation was fired, and we came back to work. And now our Team Solidarity, leads the local. We actually have an excellent contract with benefits that we built up over 45 years. But when we knew this crisis was coming, we had to assure that our workers would continue to get paid. And on March the 17th, we were able to negotiate an agreement that gave full pay and benefits, all benefits, to all of our workers, including workers on leaves of absence coming back, workers' compensation workers. And had an added feature. We're a union that participates in the struggle in Boston. And so we wanted to assist in what the needs were. And for the last 3 days, as an example, we have delivered over 1,000 meals to children, students in Roxbury, Dorchester, Mattapan, the poorest neighborhoods of Boston. We're in a struggle right now because the Transdev Corporation cares nothing for the health of our workers, as any capitalist corporation. Ours was compounded by an article that came out in today's paper. The youngest person to die of COVID-19 in Massachusetts was the Human Resources Director, Riley Rumrell, in Boston. And as Human Resources Director, obviously he had contact with a number of people. Some of our people have tested positive. I'm happy to report one of our dear union members who is pregnant tested positive. She was in the hospital. She's doing much better, and she went home today. But we have had to struggle to demand that social distancing be respected, that the protective gear be given to all of our folks. We have an agreement that we just finished up today with the mayor of the city, and he will be robocalling all of our members that says any of our members 65, which is a number of them, health challenged, or having contact with any of the individuals that we know are positive or feeling sick, will not participate in those food deliveries and will continue to get full pay. Our struggle is one which not only involves continuing our benefits and wages, but being able to deal with a ruthless boss in a remote way, which has made it all the more difficult. We have daily meetings of our executive board where we patch in the corporation, the city, and Boston Public Schools officials to do battle. And right now we are being successful in that battle. Be happy to answer any questions. I will say this, that the union has worked over the last 3 years, and I see the leader of our rideshare United Workers, Felipe, is on this call as well. And our total solidarity with those sisters and brothers. They are working some of the toughest conditions, toughest organizing conditions, and most dangerous conditions in this COVID-19 crisis. It's a health crisis, but it's a crisis of capitalism. It's a crisis of ruthless bosses, and we know how to fight that. So in the spirit of what we say, team solidarity, let me hear you say union. That's it.
Union. Thank you. I do want to let people know that we're hoping to be able to have all our panelists finish up by 8 o'clock, so that in fact there will be time for questions. You will type them in and we will attempt to make sure that at least each panelist gets to answer one of them. I do want to move on now to our next panelist. We have Nigel Boar. He is they are a rent strike organizer in Buffalo, New York, with the International Worker Solidarity Network. So Nigel, thank you so much for participating in this webinar. So there are some 47 million people who have lost their jobs just in the last few weeks and are now faced with paying rent or a mortgage that actually would have been due yesterday, and many people have a few days leeway. Tell us about how the movement for a rent strike has been organized in Buffalo.
So organization in Buffalo is kind of in the preliminary stages. We've pulled together a coalition of organizations that have been previously involved in organizing around tenants' rights and tenant advocacy. We kind of pulled the call out almost knowing that we were unprepared for it. That was a big sticking point for a lot of people initially. We made the call almost immediately after March the 16th, when restaurant workers across New York State were laid off en masse due to the governor's executive order on the matter. We were given about a day's notice, and in Buffalo alone, that's about 53,000 people that were immediately laid off. So we made the call knowing that we would need to build an organization, that an organization for this level of an action did not exist, and that we were taking on almost an insurmountable task, but with the knowledge that it needed to be done. So with that, I just want to talk generally about the call for a rent strike that's been raised here and really around the world. So 78% of the workers in the United States live paycheck to paycheck with little left over for necessary expenses. 58% of them don't have the funds to cover a $500 emergency expense. With massive layoffs depriving millions of their income, paying April's rent, let alone May's, becomes impossible for hundreds of thousands of people. State governments, realizing the mounting situation and the threat posed to the stability of the capitalist system posed by masses of newly homeless people, have responded by issuing eviction moratoriums before the demand for such had left the lips of tenant advocates and socialists. But even that is merely a stopgap measure. As soon as things go back to normal, evictions are likely to follow en masse. A $1,200 check supposedly due to go out by the end of April, but which may actually take around 5 months, is barely enough for 1.5 months rent for many, and barely enough for one in high rent areas. The $600 expansion to unemployment benefits would be a great help if it weren't for the unprecedented volumes of claim tying up online and phone applications and half-staffed state agencies taking up the task of individual interviews to confirm eligibility under new emergency guidelines. Even with those guidelines, many are likely to be left out, and many left waiting well after the rent is due. How long can we expect these funds to hold out? Unemployment is expected to reach 32% in the coming months. Every indicator suggests we are heading for a recession that will rival or surpass the Great Depression in severity. How many will have jobs to go back to when all is said and done? These anxieties have raised the call for an international rent strike, and landlords have responded by taking to private groups on social media to discuss their strategy, and to the media to raise their own anxieties, their obligations to banks and insurance companies, many of whom are the recipients of billions of dollars of stimulus funds, to utilities companies who profit on the privatization of vital infrastructure built with public funds, and to their own pockets, with many citing rental properties as their sole income, as if this should arouse the sympathy of those who actually work for a living. These cries illustrate the real intention behind the government's stimulus and relief programs to bail out banks and billionaires. Tenants are expected to make immense sacrifices so that banks and landlords who basically function as intermediaries, taking a cut for themselves, can go on with business as usual. That is, profiting by withholding basic needs, even amidst a surplus of those. This basic contradiction is the one Marx said creates revolutions: the inability of workers to afford the product of their labor. And make no mistake, housing is the product of labor, no matter how much landlords would like to pose themselves as housing providers. Landlords are an anachronistic holdover from feudalism who serve no purpose but to make a profit for themselves. They inflate the cost of housing over and above the cost of construction, maintenance, utilities, etc. by the addition of their profit margin and the real estate speculation they help fuel. Those calling for a rent strike have been accused of opportunism in the face of crisis, but the reality is this: the necessity of this action has been mounting for centuries, and it is now coming to a head. Simply raising the demand of rent forgiveness is not enough, nor is it enough for those who can't pay to not pay. We must entice those who can pay to stand in solidarity with their neighbors who can't, and call on homeowners to withhold mortgage payments. We have to achieve numbers great enough to overwhelm the capacity of courts and sheriff's departments to process foreclosures and evictions. How? Find your local rent strike organization. If none exists, start one. Talk to your neighbors directly if you have proper protective equipment to minimize risk to yourself and others, or organize virtual meetings with letters and flyers. Use social media to spread the word to others in your area, share information, and coordinate actions. It's a tall order to fill, but as activists, socialists, and revolutionaries, we have no choice but to try our damnedest in response to any crisis, especially one as severe as this. Build a rent strike, build tenant power, and build a workers' world.
Thank you so much, Nigel. So to all of you out there, if you like what you are hearing, we encourage you to go to workers.org, and there are articles, videos, and other important analysis that you can find that you might use in your own work and surely to share. You can also go to Workers' World you also can get Workers' World articles in your inbox daily by signing up at workers.org. So Megan, I believe you're going to introduce our next speaker.
Yes, thank you, Diane, and thank you, Stephen, and thank you, Nigel. Next up to share about the struggle is Virgilio Oran, who's an organizer with the National Domestic Workers Alliance and with the Laundry Workers Center in New York City. Virgilio, how has the COVID-19 pandemic and the response of New York City Mayor de Blasio, Governor Cuomo, and the rest of these politicians impacted the lives of migrant workers, undocumented?
First of all, thank you so much for the introduction, and it's really amazing to hear the panelists who came before, like Stephen and Nigel, talking about also different type of a struggle. Let me begin just by saying this, which is very important. Well, the crisis that we are going through, it is a crisis of the capitalist system. It is what the capitalist system has been designed to, which is the distribution of wealth from the working class to the rich. Just to begin, the response from the mayor and from the governor has been very timid in New York City and New York State, and from the city council. And what we have been seeing during this socioeconomic crisis, health crisis, basically it is the lack of infrastructure for working class people. If you are basically at this moment, Megan, as you were talking before about also people who work for Amazon, if you are an essential workers, you find yourself basically, especially immigrants workers, find themselves taking two choices. Or you should go into work because you will not be able to pay your rent. You need to go to work because you will not be able to meet your the basic the basic things to survive in a city like New York or in the state of New York. And you have to go into work in a very unhealthy situation in which you put your life at risk. Or you stay in your home, and basically there is not any safety, any safety net for you. There is not, if you are undocumented worker, you cannot be able to apply for unemployment. If you are, for instance, in the case of my partner who organized also with the Laundry Worker Center, if you are a laundry worker, a retail laundromat worker, most of those laundromat workers will be included even from basic leave in this particular sense, because they work for less than five in a place with less than 5 employees. So there is not real infrastructure. What this crisis has been able to do is basically to magnify, basically to expose the reality that for many years, organizers, activists, workers especially has been basically advocating, which is we need to be infrastructure that allowed us to live. Workers, basically low-wage worker, precarious worker has been living, basically working long hours, more than by average. In the case of domestic workers or laundromat workers, working more than 45 hours or 50 hours per week and getting almost at the minimum scale, or in many cases, in the case of New York State or New York City, getting paid less than the minimum wage. And the Laundry Worker Center has been able to expose through direct action and campaigns those realities that exist. Another thing about in the case of the federal, you have the state level Andrew Cuomo, who today basically is being highlighted by the mass media as a hero, which he's not a hero. One of the things that has been exposed also, it is that even the basic leave that the state passed do not basically include many workers who make less than $1 million. But we were talking also about even with the check that many that workers that working class from the federal government might receive. we know that many undocumented workers will be excluded, or no, undocumented workers will be excluded, and that basically increase the precariousness of workers in that particular sense. So what we have been doing, I had the privilege of working with the National Domestic Workers Alliance, also assisting in the underground organizing with the Laundry Workers Center. Has been pushing for policy, such as, for instance, increase in New York, in New York, basically pushing for include laundromat workers, basically with permanent basic leave, all laundromat workers, regardless the site that they work, and not just laundromat workers. This one is very important, or domestic workers. This one is we have a big problem in the labor movement in the United States that we tend to be very segmented, we work in segment, like in blocks, and we're like, I organize this industry, and I'm going just to pay attention to my industry that we work. We know that the exclusion of one segment of the working class means that everyone will be excluded. We saw that with domestic workers and farm workers back in the 1930s, and we as a working class, collectively, we are paying basically the price for that. So our labor movement needs to have like a different vision about we should not be working basically just in our own industry and thinking in a more broader sense in that. So we have been pushing for increasing the basic leave. In New Jersey also, we have been pushing to expand basically permanent basically for all workers. Also, NDWI and the Laundry Workers Center has effort, have been fighting also in different parts to create a relief fund that include basically undocumented workers. And this one is very key because undocumented workers, again, if you're being unemployed, you can go and you apply for, basically you can apply for for unemployment, but undocumented workers will not be able to do that. So that would be extremely and very important. And lastly, one thing that we want, I think that was something that people spoke about it. Our labor movement needs to think broader. And we have to be going back to the root that workers and the community, the workplace and the community are intertwined. There is not two separate things. They are very intertwined. If you're a worker, you're going back to your community. If you're being screwed up in your workplace, you're going to be screwed up in your community as well. And that's a reality. So one of the things that we need to be thinking strategically, it is at this moment, many of the workers, this one is a general lockout. This one is not, even if we in the left, we want to talk about this one is a strike. This one is workplaces, a general lockout. This one, a lockout is when the employer tells you, you should going out in the middle of the negotiation and I'm going to close the door. So the employer at this moment basically say to the workers, you are staying in your home unless you are essential workers. With every worker is essential workers. So they have been saying that the next area of a struggle, and this one was mentioned before, is going to be the ability for workers to be able to pay for their home. And home is the place that you live is one of the most sacred places. If you're a worker, it's the only place that you can say, if I want to be naked, I can be naked. If I want to say BS, I can say BS without having the supervision of somebody else telling me what I need to do. If workers lose that important space, which has been a process for a while, then we strategically as an activist, as organizers, as a member of the community, we need to be thinking about how we are going to be stopping that. And people has been thinking about rent a strike. It's a good way for the so-called labor movement to connect to the community directly and to think about how you can connect both, because that will be the next sphere of a struggle for the working class. And also to have a vision that what's happening in the United States, it is happening, this one is a worldwide crisis, so we need to be able to connect in the same way that the elite, the companies, multinational companies connect their chains of supply around the world. We need to be able to connect in a meaningful way with other working class. That is happening in Haiti, that is happening in Dominican Republic, that is happening in Africa, in Asia. So it's a good opportunity to do that. So I feel extremely, as an organizer, as an activist, extremely agitated. So if you are an organizer, if you're in your union, if you're in your community and you don't feel agitated, then shit, there is something that is happening wrong that we need to be able to change, because people are not in their comfortable zone at this moment. So it's a good opportunity to move. If you leave, pick up a notebook, we know that we couldn't do door knocking, pass flyer, put your mask. People are working at this moment, essential workers are working. So call people that you know it in your network, so we are starting to organize. Thank you.
Thank you very much.
And
So we're going to move
we have
to.
a fund. Sorry, we have a fund for in support. My partner is just basically sending me. We have a fund for laundromat workers and restaurant workers. We are going to be able to share also for people who wants to be able to donate.
Thank you so much. So we're going to move to Texas now, to our next speaker. We want to hear from Taegan Stross. Taegan is an EMS worker. She is involved in actually probably seeing some of the most desperate situations, because she's often transferring patients between hospitals, nursing homes, back and forth. So Taegan, please do let our listeners know what is happening in Austin, Texas.
Thank you, comrade. So, as you said, I'm an emergency medical services worker. I'm an EMT, basically. Most of what I do is transferring patients from one facility to another because I work for a private company here. And while I can talk a lot about the worker struggle in Austin, there's certainly more, like, I want to keep it a little bit more focused on what's going on in healthcare. So what we've been seeing is currently Austin has 351 confirmed cases with 3 deaths from COVID. In addition to this, the hospitals have not actually been hiring more people. We're seeing like the anarchy of production in like full swing, and like instead of allowing for workers like myself who like we don't really have too many transfers going on to step into those areas where they do need more people, hospitals are really just kind of working nurses, doctors, line cooks, cleaners, the technicians, everybody in the hospitals to their absolute limit to get the most out of them, because the medicine isn't really evidence-based, it's based in profit. Like the profit is first, and this crisis is just ramping things up to an 11. So things that were happening before are just happening at a much higher intensity now. So the nurses and all of them are very overworked. There's been instances where we've transferred patients who have like spinal injuries, and the nurses are just like so rushed to move the patient from our stretcher to the bed that they start doing like unsafe movements, and we have to like assert ourselves and tell them to stop. And you know, it's easy for us to blame the individual on that, but that's because they have like 20 other patients they have to get to, and they can't really take the time to take care of patients the way to. So like I said, with the anarchy of production and swing, with capitalism just doing its thing on that and still basing things on skeleton crews, people like myself and others are still finding ourselves like out of work, even though we're medically qualified and we want to help out. In fact, the reason I was able to join this panel today was because my shift was cut. Like I was supposed to be working, so I apologize for not having anything prepared. I had no intention of joining until I found out this morning my shift's cut just to save money. So rather than sending us where we're needed, we just get cut because they don't want to spend the money on it. So that's kind of like how it is here in Austin. A number of nursing homes, even the nice ones, even the like really expensive ones where the wealthy in Austin go to when at the end of their life, they're not putting out money to get new workers and new masks and things like that, because they're, you know, as much as a front they put up with patient care and like all the bells and whistles they throw at their patients, they're still based in profit. that is still number one. They didn't become those like massive companies for no good reason. And it's always because they're cutting from workers and they're cutting from patients. And yeah, I think that's about it.
Thank you so much, Taegan. I forgot to mention that you're a member of the new Austin branch of Workers' World Party. We welcome you, and we're so excited that we have more comrades in the state of Texas. I also want to make sure that everyone is aware that you can ask questions. We are running a little behind, so I'm not exactly sure how many questions we'll be able to get to, but you do go to, at the bottom of your screen, you see a thing where it says the Q&A, and that's where you type in your question. All right, so Megan, you can introduce our next speaker.
All right, thank you, Taegan, and thank you, Dianne. Next up, we have Martha Grevatt, a retired auto worker and a member of the. Thank you for coming on, Martha. Could you tell us about how auto workers have been fighting back against unsafe working conditions?
Yes. I retired last year after 31 years in the auto industry. After putting in 23 years at my plant in Ohio, I saw the blatant disregard of workers' needs when Chrysler, now FCA, closed our plant during the bankruptcy process. FCA, Fiat Chrysler Automobiles, was formed after the federal government practically gave the Chrysler Corporation to Fiat. I transferred to a plant near Detroit, where I worked 8.5 years. With the COVID-19 crisis, I again see the same profits first mindset of FCA, Ford, and General Motors, and how it impacts my coworkers and my whole UAW families. The companies did not want to close the plants. They did not want to pay workers to stay home. They wanted them in the plants, creating value, whatever the cost, even a deadly cost to their health and safety. This is nothing new, but now it's particularly glaring. Even the White House now says a gathering of 10 or more is dangerous. But on any given workday in the life of an auto worker, there is a gathering of hundreds and more often thousands of us under one roof. Social distancing is unrealistic. The workstations are not wiped down between shifts or during job rotation, and there is often no hot water in the sinks. Michigan Governor Gretchen Whitmer, a Democrat elected with union support, had deemed auto production essential work when she issued a stay-at-home order. Yet dealers have months worth of inventory, and how many actually need a new car immediately? It took rank and file action to win the right to stay home. Even in Italy, Fiat workers had to strike to get FCA to close their plants. Then there was a wildcat strike at a plant in Windsor, Ontario. Then there were work stoppages at several FCA plants in Metro Detroit and Toledo, Ohio. At the Sterling Heights Assembly Plant in Michigan, workers reported to work at the beginning of their shifts, but refused to touch any parts or equipment. They were exercising their legal right to refuse to work unsafely. After several hours, they were sent home. Now strike talk was all the buzz on social media, including among members of my local. They were ready to act to protect their lives. Later that day, FCA announced the Sterling Heights plant would be closed. And then the UAW announced that Ford, GM, and FCA were all suspending production. At first, the union leadership was only pushing for better safety practices, but the militancy of workers on the shop floor pushed them and the companies to agree to let people stay home. Under our union contract, most will get supplemental unemployment benefits, meaning they get almost 3/4 of what they make working. So they will get by. More importantly, they will live. But everyone should get full pay. The bosses have the money. The sad thing is that at least 9 auto workers have already died from COVID-19. among the many lives that might have been saved if stronger action had been taken, and taken sooner. That is why we say capitalism kills, and why we need socialism, a system where production and society are organized around human needs, where the profit motive is non-existent. That is the only way forward for humanity. Thank you.
Thank you, fellow auto worker. Martha and I have much in common. Let me just say one more thing before I introduce Ted Kelly. I do see that there are a lot of questions. Truly try to figure out a way to both get them answered on this webinar and perhaps in other ways. And there are some good suggestions as well. Our next speaker is Ted Kelly. Ted Kelly is a member of the Pennsylvania Prison Society, and he is a writer for Workers' World newspaper. So a slogan that the party has used for a long time is that prisons are concentration camps for the poor. And Frank, the famous prisoner of the Holocaust, died not from the gas chamber, but from typhus. So Ted, can you tell us about the conditions inside the walls now in the crisis of COVID-19?
Yeah, thank you, comrades, and thank you, everybody who has spoken so far. Dianne is right. Workers' World believes that prisons are concentration camps for the poor and the oppressed. And this includes the thousands upon thousands of migrants and refugees who are confined to camps across the United States. We have seen in the last decade how imperialist European states have used the Mediterranean Sea as a weapon to commit mass murder of African refugees who are fleeing the chaos inflicted on North Africa by the Obama administration. We have to be realistic about this. We have to understand that the US government has the ability to use this virus as a means to commit genocide against the 5 million Black, brown, and indigenous people that this system has captured and put in cages. Our elder and at-risk comrades in prisons include Mumia Abu-Jamal, Leonard Peltier, Imam Jamil Al-Amin, Russell Shoatz, all political prisoners. A very close friend of the party, Bryant Arroyo, he was previously hospitalized for a precancerous throat polyps. He was told by doctors that he had heartburn. He finally was able to fight to get evaluated by EMT and found out that he had polyps in his throat. Just a couple months ago, Bryant was pepper sprayed by a guard accidentally. The guard meant to spray somebody else. And later he was given a medical bill for $5. He had to pay for the saline solution that they used to clean out his eyes. This is all a way of saying that the health infrastructure in prisons is atrocious under quote unquote normal circumstances. We know that hundreds of prisoners across the country are already sick with COVID-19, and in every case it was brought to them from the outside by a staff member. One guard in New York City is dead, many more will die. Corrections officers and cops are a major vector of transmission. They're like walking smallpox blankets. By next week, 1,000 NYPD officers will be positive for COVID-19. At a Philly protest just last weekend, we have photographs of the cops, including the new police commissioner, Outlaw, aptly named, were photographed just standing around, not wearing gloves, not wearing masks, no personal protective equipment. But notice I said at a protest last week. There are protests. It was a car caravan protest where a bunch of people got in cars by themselves and shut down center city traffic. There are protests and there are victories. In Italy, there have been mass prison uprisings and jailbreaks. Hundreds of prisoners have escaped. There has been at least one jailbreak in the US in Washington state, and 6 people who liberated themselves remain free tonight. On the restricted housing unit at SCI Frackville, there were prisoners who were denied showers for days. They kicked their doors, they kicked and kicked in unison until the staff relented and let them take a shower. Frackville has lost control of an entire wing in the prison, and the DOC gang unit has taken direct jurisdiction to try and calm down the situation. There is a hunger strike ongoing at an ICE facility in Georgia. There have been a mass release of prisoners, over 6,000 in Iran. There have been prisoners released in Ohio. All of this, by the way, is available at workers.org. There's too many cases really to even talk about. Rikers Island inmates right now are being offered $6 an hour to dig mass graves on Hart Island. They're being paid slave wages to dig mass graves. And in Pennsylvania, every inmate in the state, tens of thousands of people, are under death row lockdown. That's 23 and 1, 23 hours locked in, confined to their 8x10 cells. The United Nations considers solitary confinement torture. There are 60,000 people in Pennsylvania right now being tortured by the US government. There are 4 ventilators in the entire prison system, all of which are being used trying to keep prisoners alive who cannot breathe for themselves. I mean, there's really too many things to talk about. I encourage you to go to workers.org. One thing I want to say with the time that I have left is that when we say free them all, we mean all of them. Yes, all of them. There are some people in these prisons that have committed horrible crimes. That's not why they're there. Prisons do not exist to punish crime. They exist to cage unneeded workers. They exist to keep a labor population on retainer until the bosses need them. They exist to make people work without pay. This is very important. And because I know we have this question, it's a very big stumbling block for members of our class. Why, what about the really bad, what about the child predators? What about rapists? These people need to be re-educated, it's true. But that is not why they are there. I've just gone over my time. So let me just wrap up by saying, Bryant Arroyo, who's a very close friend of mine, and a very close friend of Workers' World, has been locked up 27 years. He's an innocent man. And I spoke to him yesterday, and he said that being a prisoner right now is the scariest, it's the most terrifying position a human being can be in. But he ended the call by saying, we will rise up. Fist is up. If he's ready to fight, what's our excuse? Consider the revolutionary possibilities that would present themselves if millions of people confined to cages are suddenly free to go back to their communities. So this is why we say free them all, and that's how we build a workers' world.
Thank you, Ted. Megan?
Thank you so much, Ted. Yes, to Ted's point about things we can't get to tonight on this webinar because we only have a limited amount of time, and there's endless discussion to be had about these developments and about the struggles our class is going through. Like Ted said, workers.org is where we have a digital copy of Workers' World newspaper. Normally, Workers' World, the physical paper, is sent to our incarcerated comrades. I'm sure someone has the exact number, but a significant portion of our readership consists of prisoners. Right now, we're not doing physical copies because of the potential health risk of staffing and sending out physical papers. But we are posting articles on workers.org, and we're doing so daily to keep this work going because we're not receiving a stimulus check as an organization, and because our members, are members of this class who are also hurting, who aren't necessarily able to donate ourselves. We wanted you to encourage, if you feel like you've been learning from the content tonight, to donate to Workers' World Party so that we can keep growing our audience. You can do this at workers.org/donate or on Venmo at Workers World. And if beyond donating, sharing articles on Workers World from workers.org, sharing this webinar, it's going to be archived on YouTube and on workers.org. And if you're interested in getting involved in struggles like these that you're hearing about, we encourage you to join Workers' World Party. You can go to workers.world-party.org/join to learn more and to be a part of these historic struggles. And thank you to everybody who's presented so far. We have a couple remaining speakers. I'm introducing now Dante Strubino, who's an organizer with UAW Local 150, North Carolina Public Sector Workers Union, Durham Workers Assembly, and the Southern Workers Assembly. Dante, we learned that a sanitation worker in Raleigh recently died from COVID-19. I believe he was a former union member. I'm sorry to hear this, and we all send our condolences. Please tell us about the struggle in the South, particularly by public sector workers in the front lines of this crisis.
Thanks, comrades and friends. Yeah, absolutely. It's great to be with y'all. Yeah, last Wednesday, when we heard the news about Adrian Grubbs, our members, were shocked, still are, that he was actually the second person to die in the state, and the significance of him being a Black sanitation worker wasn't lost on anybody. This is a city that is still in the aftermath, always looking to the 2006 sanitation workers strike, where the sanitation workers shut the city down for 2 days in response to wage theft and other racist conditions the workers were going through there. And the workers there have been organizing, have been circulating demands and petitions to their boss, and have now delivered 2 demand letters to their bosses around their issues. They're still coming to work with not enough, the basic stuff like having latex gloves. Imagine being a sanitation worker, picking up trash and picking up yard waste and feces and other things, and having 1 pair of latex gloves per day, right? It's outrageous. They're not given any masks. There's no disinfecting happening in their trucks. They even have 2 and 3 and 4 workers. This is one of the big concerns of city workers we organize, is that they are sitting in a truck together, 3 or 4 workers at a time, especially in the water department where you have bigger crews. And so workers have been organizing to push back against this. Actually, workers have been joining the union, saying the demands, the righteous demands that we've been raising with the boss there. But this has been a long-term project, a organizing effort started by, some comrades in Black Workers for Justice a little over 30 years ago, shortly after the Greensboro massacre, in an effort to destroy the organization of particularly of Black workers in the state. The Ku Klux Klan in the state, as you know, colluded to murder 5 labor organizers. And our comrades and friends that survived that went in other parts of the country, parts of the state, dug themselves into jobs and to began organizing, building this organization that's now alive and thriving with thousands of workers, municipal workers, state mental health workers, university workers, auto parts manufacturing workers all across North Carolina that we represent, and organizing and fighting back and building a social movement pre-majority union. And it's important that we talk about this because none of our members are actually, it's illegal to have a collective bargaining agreement. So for any worker out there that doesn't have a union at your workplace, if you build a militant minority, a core of workers that will stand together and fight, you can win, right? In fact, that's all that has ever won history. The majority will follow you if you have righteous demands and you continue to struggle with your boss and they see whose side you're on. Our state mental health workers and the workers at the UNC hospital are on the front lines of this COVID-19 crisis, of course, are very concerned. The employers still has not, again, given the proper protective equipment that workers need. Workers are coming to work with no childcare. I've had members calling me crying on the phone saying, I'm going to lose my child or I'm going to lose my job. That's not a choice that any worker should have to make, especially in this rich country. North Carolina General Assembly is sitting on $3.2 billion, right? They call this a rainy day fund. They brag about how much money they saved in corporate tax breaks. This is $3.2 billion that needs to be dispersed to the people in hospitals, and paid sick leave and lost wages, and nutritional supplement. We've been building a broad coalition. Over 170 organizations have been fighting back, including most of the labor organizations. But we got to continue to organize. There's a lot of resistance of organized and unorganized workers across the U.S. South, as you all saw in Kathleen, Georgia. Black poultry workers at Purdue walked out. Black bus drivers in Birmingham went on a strike last week. There's workers all over the South that are raising up, and we need to raise up, particularly in this part of the country where there's the least organization, where there's the most Black workers. that organizing and resistance is happening. And so we've been building these efforts to build these local workers' assemblies. And I guess before I end, I just would encourage folks that, especially where there's a lot of unorganized, but also where you have organized people, whether it's domestic workers, we brought together domestic workers, fast food workers, bus drivers, city workers, state mental health workers, graduate workers across Durham, and built a militant organization called the Durham Workers Assembly, that we have workers' assemblies every month, and workers fight back and show up in defense of one another. And there was a strike just last Wednesday here in Durham of fast food workers that all joined a Zoom. They went on strike, and then they joined a Zoom call to report back in about their struggles. So there continues to be righteous struggles. And so check us out, Durham Workers Assembly. Let's organize the South and build a workers' world. Thanks, comrades.
Thank you, Dante. I want to make 2 reminders. We are going to take a few questions. You write them in at the bottom in that where it says Q&A, type it in. I also want to clarify, we got a question about, are we doing this often? And I do want to let everyone know that these are going to be weekly webinars by Workers' World Party every Thursday at 7 p.m. and that the next one is planned to be on the crisis in prisons and detentions. Our last speaker is Richard Caselli. He is a union delegate, 1199 SEIU, and is on the Executive World Party. I also would like to ask Richard, you know, you can't turn on the television without either seeing a video that a nurse or a doctor or someone who's inside these overcrowded hospitals trying to deal with COVID-19, and they turn around and they show that they don't have PPE, personal protective, they are putting up on Facebook and other people in the community to bring gloves and make masks and all like that. And then you turn into a White House press conference and you get repeated assurances that there's plenty of stuff and everybody's thing and there's no problem, et cetera, et cetera. So you are with 99 SEIU and represent many healthcare workers. Can you just tell our audience, even if they didn't have any doubts about it, what the true situation is about PPE?
Thank you, Diane. It's very interesting. Over the last month or so, we've seen this, what I like to refer to as a moving goalpost as to, you know, when is the proper time to wear PPE and what kind of PPE to wear. And even within hospitals over the last month or so, we were hearing things like certain people who were seeing patients and walking around in hospital hallways didn't need to wear PPE unless they were in a particular situation where they were treating patients. I think there's a guideline that's going to be released, if it hasn't been released yet, nationally now, recommending that everybody should be wearing PPE, masks specifically, even if you're walking around in the pub, in the streets by yourself. Now, that should have been the policy in early January when it was known that this virus was going to blow up. And we did know that. The virus was discovered in late December and was sequenced in early January. And the World Health Organization and China had released and written many papers. So the world scientific community knew about this. The unpreparedness that went on in this country for a full 2 months, followed by a very slow response after that even, is what's led to this critical situation. Now, as I have been watching the changes to the recommendations around PPE, this is what I think, this is how I like to describe it. The policies around PPE have been made around the shortage of PPE, not based on what's needed. Now, if say before the viruses had even hit here, which is actually the best time to address an epidemic situation that you know is coming, you go at it hard early and you stop it in its tracks. Now, if that advisement had been given in this country early on, even if the stock of PPE at that time was low, there was plenty of time to manufacture them, and we wouldn't be in the situation we are now. And now we understand that hospitals and institutions like that have to use a lot of masks and PPE have to be careful with their supplies. And so they were forced to make some of these policies that were actually unsafe to many of their employees. But they also had a problem in that they didn't have enough. There were many failures. The failures of the government are foremost, but there are other failures that happen in the society that could have alleviated some of the situation. But I think, it was so surprising, not so surprising, it is Donald Trump. But a couple of days ago in a press conference, he kept throwing out this number that one of the doctors that was in the press conference that talked about the possibility of 2.2 million people dying in the United States. And he basically used that argument over and over again to try to mitigate it and suggest that losing 100,000 people dying in this country, he was putting forward as kind of a win situation. And instead of, it's really just a sign of his incompetence and the incompetence of the entire government. It shows the nakedness of capitalism. The empire, not just the emperor, the whole empire is naked because it's failed to protect its population. We can look at the response in planned economies. I mean, look at China. They were the first hit. They should have been the one. If they were devastated, it would be understandable because it was unknown when it hit them. But yet, they responded and they protected their people and they warned the world, and our government didn't protect us. They need to be replaced. If there has ever been a sign that this is a useless system, capitalism has proven that it is. And they continue to prove it because they're still, today the propaganda is changing a little bit. There are now articles popping up all over, opinion pieces in the papers, if you look carefully, that are explaining away why people don't wear masks. They're referring to it, as in one article I saw today, as it's cultural in some places. That's bullshit. It's a safety measure that our government did not take and did not encourage us to take, and they did not let us know what the seriousness of it was. And so people didn't take it seriously. A lot of people still aren't because, this mixed messages are coming from everywhere. But there's so many job actions, for example, all of them have to do with personal protective equipment, except maybe for the one righteous action at GE, which was they were insisting on making ventilators, which is a really righteous act of solidarity. But there are planes landing in JFK right now with protective equipment. I think most of them are coming from China. You won't find much of that information in the press here. But those planes could have landed here in January. They actually wouldn't have been needed if the alarm was sounded and we had ramped up production here. So this is just, I haven't looked at the numbers in this evening. The last time I looked, we were approaching tripling the numbers of China as far as the number of people who have contracted the disease. And that's just the people who, we only know about people who have been tested. I think there are probably more people that have contracted the disease than the numbers show who have not been tested. I myself, I think I'm recovering from this disease right now. I don't know for sure, but I have to assume it based on some symptoms I've had over the last couple of weeks. I am one of the fortunate people who are working from home. I'm deemed a non-essential worker. I work in a medical institution, but I work in IT. I am working from home, and I think I contracted this thing, but I'm not counted in those statistics, and neither is my wife, who I think is also sick. And I know a lot of people like that because there's nothing to be done for us right now. Our symptoms are mild. I called my doctor. My doctor's advice was, if it gets worse, go to the emergency room. The emergency rooms aren't accessible right now. They're packed, they're crowded. If you're sick enough to go to the emergency room, you're in serious trouble. So this is a wake up. And there are lots of concessions that are being won by people. And the powers that be, the government and jobs and institutions, are starting to fear the power of workers because they're seeing the writing on the wall. I just saw, I got an email today that my institution, I work for Columbia University Medical Center. It's a huge institution, has more money than most countries. You know, Columbia is getting its own, or they actually had been planning to get their own stuff, chartering jets to go to China to get equipment. I think a lot of that has been taken over by FEMA, so I don't know if they're actually still doing that, but they were planning to last week. But a lot of institutions and smaller hospitals couldn't do something like that. So even within healthcare, there is a hierarchy. People from that work in the people I represent, I don't think right now we know of anyone who will be losing any pay, thankfully. But there are some issues with reassignments and some that we might have to worry about. Folks might be asked to do things that would put them in danger that they're not qualified for, and we have to be careful about that. The institution says that they're going to put people in places that they're qualified to, but you know, trusting bosses is not something we should do. I think that's it for now. I'll take any questions that come my way. Thank you.
Thank you so much. I think both Megan and I are very happy that we had the opportunity to be the chairs of this panel and that we've learned a lot from the speakers, our comrades. I do want to say we only have a matter of minutes, and I've been perusing the questions that have been asked, and we had hoped to be able to have each panelist, that would have been almost 10 people, respond to a question. But one I saw that I thought might be of general interest to everyone is a person who asked about plans for May Day, and asked us very specifically whether or not we were calling for a general strike on May 1st. So I thought maybe we would see whether our panelists had some points of view on that. And if you don't mind, if I could start with Martha, our auto worker comrade. Martha, are you feeling like you could talk about that for a little brief moment, and then we can see who else wants to jump in? You must be muted. Martha?
Here I am, yeah.
There you are. That darn mute button.
Any of our panelists, I'm sure, could answer that question well, but I will mention that Workers' World Party has a labor fraction within our organization, and I help coordinate the fraction's work, and we are definitely discussing how can we do May Day under these very unusual circumstances that we've never encountered before. We've always been able to be in the streets on May Day proudly. It's International Workers' Day, but the struggle must go on. There must be a protest. There must be a way for workers here and around the world to make their voice heard loudly. A general strike, it's, you know, we certainly are for it. It's a little bit of a different situation where most workers have been forced off their jobs. So the whole concept of a strike is a little bit different, but there are many workers who are deemed essential, and many of them are clearly not. There are many workers whose ability to withhold their labor could still send a powerful message. And also, right now, when we talk about strike, we need to broaden our whole concept and not just think of workers not working, but of renters not paying rent, of people not paying these greedy utility companies, homeowners not paying their mortgages. That's all been spoken about. Not shopping, students, they're out of school, but they can not do their schoolwork on May Day. And there's many ways that workers and the community can unite. It's going to take a lot of creativity, but as this webinar shows, activism doesn't stop ever, no matter what the circumstances are. We find ways to come together and fight the system, and we will do that on May Day. And please keep following us on workers.org, and we'll get out with more specific details as we discuss it, as we continue to discuss how to take action on May 1st. Thank you.
Is there anyone else who wants to answer that question or add another point to it? I'm not going to call on you, just jump in.
Just to follow up what has been said, I think that we have to, one of the things that we need to be able to do, it is in this crisis, and not in other crises, but in this crisis, to see every day as a May Day. And what I mean by that, it is basically to really starting to activate and to organize. Because after May 1st, we're going to be basically, as a working class, in a difficult situation. On May 2nd, on May 3rd, this one is a long term, so it's going to be very key. And again, just emphasizing, and this is what has been the thing that was basically repeated. It is a sphere of struggle at this moment is going to be for the working class about keeping their place that they are living. Because we are in a general lockout, basically, just to put it in that way. Even though the essential workers are working there, and there's a form of power, and we see warehouse workers, we see nurses going out and doing a strike, so that's a good way. But we're talking about a large of the workforce. It's in a general lockout, so it would be extremely critical that on bringing that point of intersection, workplace, and the community, and see May 1st. We in the movement always think about May 1st, and it's a very important date historically. But now we need to be putting our day about okay, every day is going to be a May 1st. We need to be doing door knocking, organizing, doing house visit. If you, I know that we couldn't do house visit at this moment, pick up the phone and have your one-on-one and agitation, because it's going to be extremely critical for that at this moment. The elite is very well organized, basically, and it's so well organized that in less than 2 weeks, we basically give millions of dollars basically to them coming from the working class. So we need to, we need to be strategic and organize and organize and organize and
organize and organize. Absolutely. We got a question about gig workers. Megan, did you want to answer that question?
Yeah, I can get into that a little bit. Briefly, the gig economy sort of refers to precarious employment. So Uber drivers or gig workers, the sort of appeal is the flexibility, being able to set your own hours. Instacart workers, who I mentioned were striking on Monday, are considered gig workers. The Amazon Prime Now shoppers and delivery drivers, the Amazon Flex drivers are all gig workers. And what this amounts to, and the sort of implications it has now in this crisis, is that often gig workers, the responsibility to take care of workers when corporations contract gig workers is pushed onto the workers themselves. So in the case of Instacart, the workers are being forced to provide their own PPE, their own hand sanitizer, their own Clorox wipes. Often, with the case of Caviar, the delivery company, the drivers aren't given any sort of health insurance, and many of the benefits that you would sort of typically associate with a more stable job, 401k, like any benefits are denied to gig workers on the basis that they're contractors, right? And they are in effect direct employees of these companies, but aren't sort of considered so. Gig workers are particularly vulnerable during this crisis, not only because they're being forced to provide their own protections. Uber's not, sending out PPE to Uber drivers, they're having to provide it themselves. And as workers, as essential workers, we're some of the only people working right now. And we all have communities and people who are relying on us. So even though, I have a $2 an hour raise and I'm still making money, I'm still losing money because of this crisis, because everybody around me is struggling. And, we all have a responsibility in that way. So it's not like gig workers have extra money to throw around to spend on these things, and are often left hanging when it comes to health insurance. It could be more difficult for gig workers to access testing and subsequent treatment for COVID-19. And every way that, essential workers are being put at risk right now, you can imagine that just increasing when it comes to gig workers because of these lack of protections. And so gig work is a central part of the struggle now. Our class is changing in character, and gig workers are making up an increasing percentage of our class. And, to be in solidarity with healthcare workers and organized workers and workers with benefits, we also have to be in solidarity with the gig workers who are also making this economy work right now and are getting even fewer protections than even, I'm getting or my fellow workers at other grocery stores are getting. So that's sort of that on the gig economy.
Thank you, Megan. So I just gotten a message from our administrators that we could go a little over 8:30. I realize that that's impeding, people have given a considerable amount of time to this, but if we want, we could have maybe 2 more questions. I see that Ted had said that you also could make a quick point about strikes in prisons. And since our webinar next week will also be on that, this might be a teaser for what we're going to do next week. So why don't you go ahead?
Yeah, my pleasure. I'll be quick. So the name of the new prison page for Workers' World is Tear Down the Walls. And, I hope that this is a demand and aspiration that is not merely metaphorical. But there is a huge mental barrier. And it is easy for those of us on the outside to ignore the strikes that are going on inside prisons. I've told this anecdote before, but there was a protest in Philadelphia a few years ago where a column of marchers marched past the federal prison that's right in Center City at like 7th and Arch, right around there. And we stopped outside the federal prison and we're chanting, "You are not alone." And we looked up at the windows of this facility and we saw the lights flashing on and off. The prisoners heard us, and they, in that moment we were joined, they joined the protest. I think that any kind of action that we can coordinate on both sides of the wall would be really effective. First Secretary Larry Holmes talked recently about our support for the rent strike. If for no other reason than it'll scare the shit out of landlords. Imagine the fear that it would strike in the hearts of the ruling class if there was a May Day where prisoners and non-incarcerated workers were striking at the same time for the same goals. Imagine a general strike where prisoners were involved and withheld their labor or refused to leave their cells. Just something that I want to get people thinking about. That's all.
Okay, I see a question from I see this response from Taegan, and I think maybe in response to what Richard said about that ICE agents have PPE. She also said that she could talk about healthcare strike, if I'm reading your text correctly. So Taegan, did you want to say another word about this?
Yeah, so someone asked if healthcare workers should strike if we're not provided proper PPE. And, some things we know about strikes are they are best conducted whenever times are good, like companies are making a lot of money. So that's very true for healthcare, like hospitals and all those private companies right now. They're making just gobs of money off the working class. Right now, they are just like vultures with full bellies right now. But the issue with it is that as healthcare workers, our patient health comes first. Our patient health and our health comes first. So strikes are like, the laws around strikes for healthcare workers are different. We can't just like walk out on a patient and like refuse to work necessarily. We can refuse to do procedures and things like that that are non-essential if they're going to cause harm to ourselves. So if I don't have the proper PPE, I can absolutely refuse to pick up a patient until I get that PPE. So we do have that available to us. I think it's a really good proposition. And I know that in the past, when healthcare workers have struck, they've mostly had to coordinate it in order to allow the hospital to hire outside people to kind of take over. Like they have to hire scabs so the patients don't just sit in a room by themselves. So I think the biggest imperative for healthcare workers right now is for us to just unite in general and start discussing how we can, improve the conditions for ourselves and our patients. And then, the talk of a strike can be a collective decision. Because there's just so many factors to a healthcare worker strike that aren't necessarily involved in like fast food strikes or other places.
Thanks. Dante, I'm going to ask you a question because I know that the Southern Workers Assembly has made Medicare for all or healthcare for all. That's sort of a central organizing demand in North Carolina and in the South. Would you comment, and perhaps be our last person who gets to comment on this webinar, about the, I guess the relationship between the inadequacies is not even a good word, the absolute failure of a capitalist, unorganized, disparate healthcare system being able to meet people's actual health needs, especially during a crisis like this, but really all the time. Could you talk about that a little bit?
Yeah, absolutely. I think it's a really good, important question. In North Carolina, one of the struggles that the liberal movement talks a lot about is the fact that when Obamacare was passed, the southern states, many southern states refused to expand Medicaid. And so you have 500,000 people now that would be eligible in North Carolina for Medicaid. It's 500,000 people that have no health insurance that would have been. And so and this is just like, one sliver, right? The whole entire for-profit or even non-profit healthcare system in this country is not set up, to meet the basic needs. It's not set up in a way. I mean, there's many rural communities that have no access to hospitals, despite there being, hundreds of thousands of people that live in these parts of the state, and rural hospitals closing down and the capitalist government doing nothing. Especially in this time of need. We've seen the last 10 years, we've seen, several rural hospitals in North Carolina close, down with no support at all. People having to drive, 2 hours, to get to a hospital. When you're having a major respiratory attack or some condition related to coronavirus, this is a death sentence, right? And so in the Southern Workers Assembly, we've been fighting to raise up the demand to eliminate the entire, for-profit health insurance industry. Why is it, we're one of the only countries in the world that has a capitalist for-profit health insurance, right? Not to mention the healthcare providers and the hospitals themselves, but we're talking about trillions of dollars of profit and of administrative waste of folks to shuffle paperwork. When you get sick, you don't want to have your health insurance deny you health your healthcare. You want to talk to a nurse. You want to see a doctor, right? Healthcare as a basic human right is going to take a struggle, and so we're the struggle for universal single-payer healthcare, there's been many ebbs and flows in this country, many contradictions about it. You know, and one of the difficult things is that the labor movement, from the very beginning, fought for, because of in the 20s and 30s, the revolutionaries were fighting for single-payer healthcare as a demand, right, to liquidate this whole section of the capitalist ruling class that we now see is really blossoming with health insurance industry, which is totally unnecessary, provides no social need. That instead of, you know, when we weren't able to be triumphant as a movement to get the government to expand like other countries did in the imperialist West and even around the rest of the world, you know, universal single payer, nationalized health insurance under a capitalist government, even that they began to turn to have employer-based healthcare, and so they fought their employers, and of course that fractured the whole movement, and it meant so that, you know, it was based, now we have a system that's completely based on you have to have a job. And even if you have a job, you have to be lucky that your job even has any health care provided at all, which is a total contradiction. You shouldn't, you don't need health insurance just because you work or not. Everyone needs health insurance, right? Every worker needs health insurance. And so, in the Southern Workers Assembly, we've been using this as an organizing opportunity to go to unorganized workers and to talk about the contradictions in the for-profit capitalist healthcare system, and to use those to organize their workplace, to fight their boss, right? And to build a workplace organization, Medicare for All committees. We have since last June, we've had 3 worker schools, one in Charleston, South Carolina, one in Raleigh, and then one in Charlotte, with Southern workers, you know, 60, 70 Southern workers, some, you know, longshore workers and nurses. Part of the National Nurses United is linked up with us. You know, folks in the Fight for 15 and others, and our public sector workers in our union and many others have linked up to build the 50 workplace committees across the South to organize workers and use this transitional demand to build power of workers and to challenge their employer to speak out. Sure, it'd be nice if Congress passed this bill, but we're using this to organize workers to build power and to challenge their employer and expose those contradictions in the capitalist healthcare system. So you can check out southernworker.org. There's a lot of information about the Southern Workers Assembly Medicare for All campaign. Definitely looking for any comrade and any people here that are in the South that are interested in linking up with us. We have a lot of tools and workplace things you can use to actually build a committee around and be part of this campaign that the Southern Workers Assembly has been building for the last 7 or 8 months.
Thank you so much, Dante. All right, Megan, you and I are gonna clap. You know, we're not in a venue where they can hear all the applause. I want to, on my own, for my own part, I want to really thank all of the members of this panel. I want to thank those of you who have stayed a little past our time. I want to encourage you to tune in again next Thursday, 7 o'clock. That discussion will be about prisons, detention centers. There you see the slide right there, and our demand to free them all. We want to encourage you again to go to workers.org. Keep up with us, like us on Facebook, spread the word of our extraordinarily well-written articles that appear in Workers' World newspaper. And Megan, but you have a last word?
Yeah, I didn't know if Richard wanted to comment on something.
Oh, I'm sorry, I didn't
before
see that.
we end. No, that's okay. Richard, was there a comment you wanted to make?
Yes, there was a question about how to get in touch with us and work with us.
Oh.
We have on our page, our main Workers World page, workers.org, there's a contact page where you can share your information with us or call us directly. Our email address is wwp@workers.org. You could send us an email directly. You can also sign up for subscription of our online articles that you would get in your email. There are lots of ways. It might be hard to meet with us depending especially on where you are in the country. We have branches in a number of cities, but we also have members in at-large areas where, you know, we communicate them through a staff we have called the field staff. We have a field staff that stays in touch with people who aren't in a particular branch. So and some of those areas do become branches if they get a certain concentration of members. So there are many ways to work with us. Contact us, and you can find out on our page at workers.org. Our office is closed right now for visitors, so you can't visit us at this time. Our main office is in New York. I'm in New York. We have other offices, of course, in all of our branches, but our main office is closed right now. So you can't visit us there, but contact us and we will get back to you. Thank you.
Thank you, Richard. And then one announcement from the Q&A. The Caribbean Anti-Imperialist Network will be holding a solidarity meeting with the governments of Venezuela and Cuba on Zoom, meeting on Sunday, April 5th at 11:30 a.m. Barbados time. And David Denny wanted to extend an invitation to everybody on the call to join that meeting. So just to repeat that, Sunday, April 5th at 11:30 a.m. Barbados time. Also in the questions was one about should we boycott Amazon? Yes, boycott Amazon. That's the short answer.
No brainer.
Cancel your Amazon Prime subscription. It would take a lot of time to get into actually how awful Amazon is, and even ordering your food from Whole Foods through Amazon. Short answer: boycott Amazon. I don't use Amazon. I don't have Amazon Prime, and my life is running as smoothly as it probably can be given the pandemic. But yeah, to close, I wanted to echo comrades' points on submitting a form to join the party if you resonated with the struggles that folks talked about tonight. There were over 250 viewers in Zoom, and we had over 1,000 views on Facebook. So these webinars are growing, and if like I said, if you resonate with the work, hit us up. Contact us. Like Richard was mentioning, the ruling class is highly organized, and we have to be just as organized. We have field staff that will contact you if you're not in a city with a branch. But I can attest to, how helpful being in Workers World has been to staying in the struggle for me and to supporting the struggles that I'm going through now. And I'd like to also echo the thanks to everybody for staying slightly past our initial end time. And yeah, we can, we can get a link for the anti-imperialist webinar and perhaps send that out through email. David, if you had a link to that, I know you posted in the Q&A, perhaps you could send that in the chat. But yeah, if anybody else has anything before we wrap up, I think this was an awesome webinar tonight, comrades. Thank you to our panel, and thank you again to everybody that tuned in. David said they'll send the link tomorrow. So on that, any closing remarks comrades like to make?
Build a workers' world.
The workers' world.
The workers' world.
Just one more thank you. We want to thank our two admin comrades who kept us online the whole time, Leilani and Scott. Thank you so much. And it was a collective work, and we appreciate everybody. Stay well.
Good night.
Thank you, comrades.
Good night.